Good day to everyone who is listening right now. And I would like to thank you very much for including St. Luke's Medical Center College of Medicine in the Open Image community of practice. So with this, I hope that you will let me introduce to you first what is St. Luke's Medical Center College of Medicine William H. Quasha Memorial, which is also called your SLMCCMWHQM. So St. Luke's Medical Center College of Medicine was established in 1994, making it a young college of medicine in the Philippines. Being a young college of medicine, incorporating innovation has been in its foreground. The SLMCCM offers innovative subjects throughout its 5-year medical curriculum that enables its students to not only be clinically competent, but also to be a more holistic physician. These innovative subjects are not offered in other medical schools, and these subjects allow students to be more critical thinkers, expands possibilities of being a physician scientist, and develops the medical students to be socially engaged and compassionate. So, in the 5-year medical curriculum, the first 3 years are considered the basic and clinical medical education, while the succeeding 2 years are time spent by the student not only in the medical center but also in our adapted communities. So, for about 3 months, a Lucan medical student will be exposed to the community. One of our adopted communities is actually Barangay Old Balara in Quezon City. Old Balara is an adopted community of both St. Luke's Medical Center College of Medicine, together again with a foundation called your Sons of Charity Foundation. So it has a land area of around 521.6824 hectares, comprising of 6 sitios or areas. There are about 50 streets and 150 alleys. Population was determined by the 2015 census at 71,022, which represented 2.42% of the total population of the city it belongs to, which is Quezon City. Within this old Balara, St. Luke's Medical Center College of Medicine has an adopted community together with the Sons of Charity Foundation. Our adopted community is found on the northern area of that comprises two sitios or areas called Sitio Laura and Villa Beatriz. It is in this community that our fourth year and fifth year medical students do their family and community rotation wherein they do family visits, community diagnosis, and community programs. So here in this picture, you will see that our students are going through the different nearby schools to share to the students about proper hygiene or any program that is health related, which is very timely at the time of their visit. For example, in this picture, they have really taught the students on good hygiene. But aside from that, our students are also seeing patients in this small community. And it is here where we plan to use specifically the Open Image software. As I have shared, our college, together with the Sons of Charity Foundation, is serving this smaller urbanized community. Our students for 2 days in a week hold clinics in the church wherein the health records of the members of the community are currently stored, but this at this time it is through paper and backup is done in an Excel program. Common problems usually encountered by students in these methods are records that are not found in the files, data was corrupted as the file was only passed on from student to student, and non-consolidation of family records. When we did the Open Image Software Training Program last November 9, 2019, we knew that the best area to apply this program is in our community program. Hopefully, with the software, Health records will easily be stored and accessed as it is cloud-based. As this will be applied in the community health program, our goal is not only to treat the single patient who went to the community clinic at that time. Ultimately, with the help of the open emails, we hope that it can give our students an opportunity to practice their public health and population health as they try to analyze health data that can be retrieved from the program. Our students understand that with an electronic health record, data can be better analyzed that will help them evaluate the current community programs and also allow them to develop community programs that are timely, and we hope that open emails will drive us to go there. So thank you for your kind attention, and I hope that together with open emails, our preventive and community medicine program can move forward to give proper service to our adopted community.
Right. Thank
Thank
you, Dr. Sharma. So, to all our participants, if you have questions or suggestions, please feel free to send us a message through the chat box or the questions box. Hello, Dr. Sharma. We
yes,
have one question from our participants. So,
yes.
what are the challenges that you think they will encounter in using Open EMIS as an EMR?
So if we are going to use open emails, as this is a community setting wherein this is a urbanized, poorly urbanized area, one of our main problems is actually Wi-Fi or our being the students being able to connect without using their own data. So actually, we have been working it out so that communication with the community can be done. But again, data is still being studied if it will be included. So one of the hurdles I think will be Wi-Fi connectivity of the students, and also having a main port wherein they can store the data. Right now, since the good thing about OpenIMS as we see it is that it is cloud-based, so that any student that has their own computer can access the data. But of course, maybe later on we might um, allot one computer in the community, if of course the foundation will also allow us.
Thank you, Dr. Sharma. We have another question.
Yes.
How do you plan to train the students? Will you also include health staff from the community?
So I think training the students was quite easy when we did the training last November, as they are around 20 to 25 years old. They already know how to easily navigate through a program. With with this, hopefully we can do training a day or during their rotation in the community. But for the health workers, as these are like barangay health workers or community health workers, we also have to train them in using the program. And maybe we can invite again Miss Chat um, to do the training with our community health workers. But I think we have tried navigating through the Open Image software last November, and we think that it is quite easy to understand, although there are some, um, we would like to edit some of the features that I have already shared with the group previously.
Yes, thank you, Dr. Sharma. So we have a question from Dr. Piakorel from Nepal. The
Yes.
question is, what is the impact of community health program at policy level in the Philippines?
What I can only say that at our level, since we only have just two little areas that we hold. And then right now, what we do is not really on the policy on the whole Philippines, but rather just on the barangay level. So from holding just two small areas in the barangay, in the barangay, we can actually have it expanded into a bigger area and hopefully into the city. So that is only what I can share at our level. But of course, if eventually the community will really be active on it, policies are really made at the level of our family and community medicine doctors that are also part of the Department of Health. So they are the ones who are really looking into how the community can be helped and eventually do a policy audit.
Thank you, Dr. Sharma. We have another question. So,
Yes.
what are the goals of your current community medicine program?
Mm. Right now, our community medicine program is not just on looking at patients, which is what we first looked into applying the open image software. But eventually, what we want is for our students to apply the concepts of population health and public health on their own little barangay.
We have another question. So,
Yes.
what are the metrics for success, and how do you know when you're ready to scale to other places?
So right now we haven't really got into the more details of how we will go again with the program because we are still talking. We will still be meeting with the developers so that we can change some of the features of the open image program. But eventually, our first metric there was if, for example, like for now that we have this COVID pandemic, what we want is really use eventually this for contact tracing. It can be used also um, in teaching the community on proper hygiene, maybe on about the facts on your COVID. So this is one thing that we are looking into on the use of our open image eventually, and not just um, having it as an electronic medical record, but eventually using the data that we had from the electronic medical record into using it into the population, which is the barangay for this time.
Thank you,
And
Dr.
also,
Sharma.
I'd like to share to you that we only have jurisdiction on these two little areas and not yet on the barangay level, as we still have to coordinate with the city level on how we can really go into the different barangays with this open image software.
Yes, thank you, Doctor. Our next question reads, how can a health information management system contribute to the achievement of your community medicine program goals?
Mm. Since most of our goals are really on educating, one is educating our community. So, um, with the data that we will be having in this open image software, what we can use that data to develop the programs that we will be um, sharing with the community. So it's not just having those data that is specific to one patient, but eventually going into its family, into its street, and eventually into its barangay. And hopefully, if we go to expand it together with the city.
Right. Our next question is from Dr. Deepak from Nepal. Dr. Sharma, so what are the components of HIS in your community health program?
Right now, we don't have any computer-based health information system. What we only have is just a few number, just a census of the patients that are going into the clinic at specified times. So I think the open IMIS will really help us to have a bigger coverage in this community to help this community better. So I hope that the open IMIS software will be our tool to give more service to this little barangay.
Okay, thank you, Dr. Sharma. We have another question. So these are two
Yes.
questions from one of our participants. So first,
Mm-mm.
are there policies implemented in looking into data privacy for underage patients? And do they need parents' consent in storing the children's health information?
For the children's data, sorry, but I haven't looked into the specifics on it, on the data privacy law uh, that is available now in the Philippines. But I think it will still follow that um, whatever data we have, we will still be following what is on the data privacy law. Um, since this is at a community setting, again, we still have to talk with the community health workers, with the municipal health office about this, and, and how to coordinate this with also the medical center and, of course, with the school.
Thank you, Dr. Sharma. So our next question is there's a message. The frontline healthcare providers in the community have difficulties of doing their target clients lists because of many DOH programs they are implementing, and it requires voluminous data they need to accomplish. The question
Yeah.
is how HIS operates that could help the midwives and nurses in the primary healthcare facility.
If, for example, we have this health information system that will be available, we can really see the trends that is happening through time in a certain community. And if these trends are really looked upon, and hopefully our students will be the one to look into these trends, and hopefully if they look into these trends and find something that is of need, they will be the one to share it with the barangay health workers or the midwives on what is the appropriate action after the identification of the health trend that is currently happening. So what we really are seeing right now is that with at the initial few months or maybe in few years, few months to up to a year with using the open IMIS program, is that of course we will just get data from single persons and maybe correlate it with what is happening in their family. But eventually what we want again is to correlate it to what is really happening in the community that they are in now. And then, of course, if the students with proper training and of course with the help of their mentors, they will be able to analyze the data that they have so that the trends can be seen and appropriate action can be done not only by our students but also together with the municipal health officers or even the barangay health workers or even with just the Sons of Charity Foundation that handles the two little barangay or sitio that is being covered by our students right now.
Thank you, Dr. Sharma. Is it possible to provide an open HIS to a community whose health system isn't that advanced, or to a hospital in a community who isn't capable of having technology due to financial strains?
Having try one of the projects of the college is really into innovation. And right now, of course, technology, finances has been looked into, budget constraints have been looked into. But I think if, for example, these projects can really be looked upon, tried upon, tested upon by our College of Medicine, maybe we can actually do this, and we will we will be able to share to you how we have done it, and hopefully this and those problems like financial and those that um, not of those not having a good health system, this will be the way for them to move forward. So that this open image hopefully can be a tool that can move forward this community. Thank you.
Thank you, Dr. Sharma. Our next question is, can the data gathered using this system be used in conducting researches that would contribute in providing a better and safer quality medical care? If so, do we need to write a request to use or not?
I think if this is going to be a research, we will still go into the ethics of doing a research. But again, one we should also look into is always data privacy. Okay, so there has been a question earlier about data privacy, and I think um, if research is to be done, ethics should also be done so that data privacy can be protected with our with the residents of our barangay. Thank you.
Yes. Thank you, Dr. Sharma. We also have Ms. Christine Pascual on the call. So, among the questions from our participants, someone is asking, what is the difference of open MRS and open EMIS? And I think we can answer
Yes,
more on what open EMIS is. So maybe
yes.
Miss Christine can help.
So to answer the question, both softwares are part of the OpenHIE community. So that stands for Open Health Information Exchange. So they're both open source. The source code is available online. And what differentiates OpenIMS from Open MRS, which is an open source system for EMRs, is that Open IMIS is a tool for managing health financing schemes and health insurance. So it's specifically used for health financing and health insurance. I hope that answers our question. Over.
Thank you, Tin. So I think this is our last question. So Tin or Dr. Sharma can answer this. Does OpenIMIS use internet to operate? If so, will the data stored in this system still be accessible if there would be a sudden electricity shortage?
I think you answer that one.
So regarding the open MS software, there should be internet to operate the system, but it was specifically developed for low resource settings. So these are areas that have poor internet connection. And regarding the storage of the data, so since it's open software, you need to have a server which can host the open source software, the open OpenIMIS. So the server will be able to store the data.
Thank you, Tin. So I think that's the last question from our participants. So any last words from our speaker, Dr. Sharma?
Again, I would like to thank AeHIN for choosing St. Luke's Medical Center College of Medicine to be part of the community of practice. So I hope we can move forward with this, and hopefully with some tweaks in the program, uh, we can really use it in the community, because as far as we see it right now, there is a vast range of capabilities that this could help us, not only us, the College of Medicine, but also in our community, and also to our the families that belong to that community. Thank you.
Thank you, Dr. Sharma and Ms. Tin, and also to all our participants for making time to join this webinar. We hope that you're always safe. Thank you. Good night.
Thank you. Good night.